Hello, everyone, and welcome to today's webinar titled Navigating the SARS-2 Pandemic at Riverview Health. This webinar is part of the 2021 Microbiology Virtual Week, and I am Susie Valdez of LabRoots, and I will be your moderator for today's event. Today's educational web seminar is presented by LabRoots and sponsored by Luminix. For more information about Luminix, go to www.luminixcorp.com. So let's get started. Before we begin, I want to remind everyone that this event is interactive and we encourage you to participate by submitting as many questions as you want during this presentation. To do so, simply type them into the Ask a Question box and click Send. We'll answer as many questions as we have time for at the end of the presentation. Now, if you have any trouble seeing or hearing this presentation, click on the Ask a Question box located on the far left of your screen. As a reminder, this presentation is educational and offers free continuing education credits. Click on the Continuing Education Credits tab located on the far right corner of your presentation window and follow the process to obtain those credits. I now present today's speaker, Ronald Reitenour, an Area Coordinator of Microbiology, HAZMAT, and Disaster Preparedness for Riverview Health in Noblesville, Indiana. For a complete biography of our speaker, please visit the Biography tab at the top of your screen. Ronald, welcome. You may now begin your presentation.
Hello, my name is Ron Reitenour, and I'm with Riverview Health in Noblesville, Indiana. We are a 156-bed full-service hospital. This facility is located north of Indianapolis, about 45 minutes from downtown Indianapolis. We also have a 16-bed hospital in Westfield, Indiana, approximately 7 miles to our west. And then we also have 3 freestanding urgent cares, as well as over 24 primary, immediate, and specialty care locations here in Hamilton County. Our laboratory is a full-service laboratory. We include micro, molecular diagnostics, cytology, and histology. One of the things we're really proud of here is just over 97% of our test requests from our physicians and all of our client facilities are performed here in-house. And we provide reference laboratory services for 3 hospitals, as well as 14 long-term care facilities. So prior to the pandemic, we had 4 different molecular platforms that we had employed in our laboratory. We had the Cephia Gene Expert. On that platform, we run MRSA surveillance, C. difficile, Group B strep, as well as a genetic mutation test for factor 2 and 5 coagulopathies. We also brought in the Panther in 2013. In the Panther, we have a pretty robust menu. We run gonorrhea, chlamydia, mycoplasma genitalium, trichomonas vaginalis, HPV, HPV genotyping, and a vaginitis panel. A couple years after that, we were able to bring in the Abbott ID Nows as a quick molecular screen for flu A and B, RSV, and Group A strep. And then in 2016, we were fortunate enough to bring in the Verigene platform. On the Verigene platform, we run the gram-negative and gram-positive blood culture panels, as well as the respiratory flex panel and the enteric pathogens panel. The benefits that we saw in bringing the Verigene in were a lot towards our antimicrobial stewardship program. So the blood culture panels, compared to conventional culture, allow us to do directed treatment 28 to 48 hours faster, which is much better for patient outcomes. The respiratory flex panel provided us a very robust screening tool for respiratory pathogens. It provided us a backup for our rapid flu and RSV testing. And we had a large amount of Bordetella testing that was coming from PEDS practices that we were having to send out. So we were able to bring in all of these assays under this one platform and do quite a bit, as well as with the enteric panel, improving the screening tool we had over conventional culture. Life before the pandemic, in my department, we had 2 to 3 FTEs on day shift, just depending on the day of the week and the volume. On the Veregene, those volumes included a very steady amount of blood culture and enteric panels. And then, of course, the respiratory panel volume varied depending on the season. So fall and winter time, we would see a significant increase in that volume. But that was easily handled in the daily workflow. At the bottom of the slide, you can see the Veregene workflow for those of you that aren't familiar with the platform. It's a very effective tool for a facility our size. We started off with just one of the processors and reader. We're now up to 3. But you can see on the bottom there, it's pretty simple, just adding your sample, the different components, and letting the instrument do the processing, and then at the very last step, reading the panels for you. So, as the pandemic started, there weren't very many assays available to any facilities. So all of our testing was either having to be sent to a state laboratory, or once some of the large commercial reference laboratories started offering it, there was places that we could send COVID PCR testing. So initially, before we had any capabilities, we used the Veregene respiratory flex panel as a rule-out test. So in fact, the state lab, in order to send a specimen, you had to get authorization. So we would perform the test in-house with the respiratory flex panel. If no targets were found and we had a symptomatic patient, then we could get approval to send that specimen to the state for testing. We did have 2 platforms that were initially available for testing. They were the GeneXpert and the ID Now. But because of the amount of facilities that use those platforms, it was next to impossible to get a sufficient inventory to really do any significant testing. Therefore, we went with purchase of an Aries platform, and we started with the Aries and doing a lab developed test. Once the lab developed test was fully implemented, then the EUA became available. So we were going to transition straight to the EUA, but because of allocation issues then, for quite some time, we ran both LDT and EUA for COVID on the Aries, and the usage was just based on what product was available that week, how much we could get. So until the large-scale production of the EUA, we mixed both LDT and EUA in the same day sometimes. Now we are exclusively on the EUA assay. What the Aries really allowed for us to do was prioritize patients in our facility. So we focused on patients in our ER. We focused on getting our surgeries, elective surgeries, back operational. So we were able to screen those patients in-house the day before testing. The day before their surgery. Any employees that were suspected of being infected, we were able to run those and get those results out the same day for employee health. And then we've supported 3 to 4 of our local fire departments in testing the first responders from those departments. Because of the testing that we were doing, the Indiana Department of Health reached out to us to join a network that they were creating to help increase the capacity of testing within the state. So initially, they asked 9 laboratories across Indiana to join this network, and with that, we were able to get a higher increase in the allocations of various reagents. And since we already had a Panther in-house, we were able to bring in SARS testing on the Panther as well. As part of that partnership, we also obtained a second Aries instrument that we put in place. So as the volumes continue to increase, we did have a problem with the Panther because the TCAN tips that are used on the Panther became very hard to get, and those were on allocation. So even if I could get Panther Aptima reagents, I might not have the tips to be able to run the instrument. So therefore, working with the State Department of Health, or the Department of Health, we ended up adding 2 Luminex MagPix instruments, as well as a bioMérieux eMag to do the extractions, and then 2 thermocyclers. So as the pandemic raged on and we were doing all this testing, I was able to add 2 FTEs to the department. So we added an additional FTE to day shift and then 1 to second shift. And we had not had anyone but generalists on our second shift. So we added a molecular specialist onto our second shift just to keep the Panther instrument flowing and then run any of those that we're going to run on the Aries, bringing those in at night. The MagPix and the Panther combination really allowed us to increase our capacity in a major way and reallocate the use of the instrumentation. So we ran a lot of stuff on the Panther, so bringing the MagPix in allowed us to take some of the burden off of that so we could continue to perform some of our other testing. In addition, when we got both of those online, the state started sending specimens from outside our network to us to run. And a lot of those tests that were being collected within the county were actually being ran out of state because of the capacity issues all around the area. So there were a lot of tests going, I believe, out to Wisconsin that we were able to keep in state within the county. And then, of course, running those other larger high throughput platforms allowed us to really focus more on the Aries as using it for our direct admits, again, more pre-surgical screening, employee screening, and our first responders. Pandemic stabilization, we did have a time where things were starting to decrease pretty significantly in volumes. As I record this, the last 2 weeks, we have been back at record volumes. So the slide is chronologically good, but we are very busy again and back to high pandemic levels. But use of these platforms really was helpful when the volumes started to decrease. So we changed our focus from doing all the testing that had been coming in, because it was a much lower volume. We started offering direct-to-consumer testing for individuals that needed travel testing. So they could pay up front, schedule an appointment, and because of the way the Aries platform works, we were able to get these results out the same day for these folks. And that's really important because of the time frames that some of the countries were requiring. Most of them are 72 hours, but it kind of depends on what connecting flights you have. Some people were having to get results back the same day so that they could make their flights. It's been a very popular program, but it did have some drawbacks. Each destination has very specific requirements. So the type of test used, you had to make sure a lot of them require real-time PCR. The collection methods, was it nasopharyngeal, nasal, oropharyngeal, what? And then eventually we had to add a QR code to our reports just to satisfy specific requirements for some countries. Kind of one of the odd things is that we've sent people with travel testing to all over the globe and not had any issues, with the exception of Hawaii. And Hawaii will not accept our results because we're not an approved lab on their site. But I just thought that was interesting because we've been approved by all these other countries except for a state in our own country. So moving on from the pandemic, hopefully the surge we're in right now will subside and we can start getting back to normal. But moving on from the pandemic, having these different platforms in place, we're wanting to to really be able to expand what we're offering. So on the Aries, I want to increase test offerings. One thing for certain that I want to add from there would be the HSV 1 and 2. We want to increase our Panther test offerings, HIV quantitative, as well as HCV and HBV. And then hope to upgrade our Verigene to the Verigene 2 platform. That should be a pretty exciting offering, and when that comes out, my understanding is there'll be a flex panel for the enterics as well. So one of my jobs at the hospital besides microbiology is emergency management, and we always look at any exercises or responses, lessons learned. So from our response to this COVID pandemic, some of the things we've really learned are flexibility in the laboratory. Prior to the pandemic, in a lot of cases, especially molecular-wise, we really just tried to minimize the number of platforms that we were using so that we could control costs and not have too many different instruments that we had to manage and maintain. But with the way the supply chain broke down during the pandemic, we learned we really need to be more flexible and not rely on a single platform or vendor. So we want to be able to implement testing across multiple platforms. So if you've got 2 to 3 different platforms that you can alternate on depending on the available resources, then you can continue to offer those services even when the supply chain breaks down on you. So one thing you really need to do with that is make sure you validate multiple specimen types and collection devices across those platforms, as well as look at a way to prioritize testing on one platform over the other. The other big thing is, we're a relatively small laboratory, and I've always steered away from doing LDTs or lab developed tests, but use of the LDT really provided a lot of flexibility, and we were able to adapt quickly. Luminex did a great job in helping support and helping to teach and give me understanding of what I needed to do as far as validation for an LDT, and it just made a huge difference, and it got us up testing much quicker than waiting for the EUAs to be available. One of the major things, though, that is still a challenge is storage space. So bringing on multiple platforms and having issues with being able to obtain viral transport media, being able to obtain pipette tips. We had to purchase as much of each of those type of items as we could when they were available. So I actually had to take a mechanical room that we have down the hall from the laboratory and change that into a storeroom to be able to have enough space. Lastly, you want to have a transition plan. And this can be as simple as my priority samples go on this instrument, my backup samples, or the ones that don't require as much of a short turnaround time, they can go on this platform. And then if reagents aren't available for platform 1 or 2 or 3, how do you transition between each of those? So this table shows our current platforms and the assays that we have in-house right now as our current assays. And then it also shows potential assays that we could bring on board. So in working on a transition plan, you want to look at what all options do I have in my laboratory currently that I could quickly transition from using one platform and going to another. It's not always easy to keep reagents on board for everything, but if you at least have one alternate platform to move to, that'll allow you to continue providing that test even when you have a supply chain issue. All right, so another transition to think about is just when you go from high volume to low volume. So as you can see, the Panther is one of our primary high volume instruments. When the volume decreases, we can focus more on the Aries, which is an easier and cheaper platform to run. And then as volumes go back up, we transition back over to the Panther, which is what we're seeing majorly right now with this uptick in the surge that we're having in Indiana right now. And with that, that's the information I have to provide. If you have any questions, I'll be happy to answer those questions for you.
Okay, great.
Thank you so much, Ron, for your informative presentation. We will now start the Q&A portion of the webinar. If you have a question you'd like to ask, please do so now. Just click on the Ask a Question box located on the far left of your screen. Let's get started. Our first question I have here, Ron, what type of quality assurance do you perform between platforms?
So we purchased the CAP quality cross-check survey. It comes out twice a year, has 3 challenges, and then you can perform it between all platforms. But of course, you could use your own samples just between different platforms.
Thank you. And then the next one I have here, what has been the biggest challenge with testing during the pandemic?
I would say without a doubt, just dealing with supplies, making sure that we have enough of the different reagents to run the different platforms, but probably more importantly than that even is all the consumables that go along with it. Been a lot of issue with plastics over the last year and a half, and of course most of the components for consumables and the cartridges are plastic, so simply just trying to keep ahead, finding different vendors to go through, and really changing the way that I used to order. So I used to order a case, now I'm maybe ordering 10, 20 cases at a time. And a little less concern about expiration dates because we go through things so quickly.
All right. Thank you so much, Ron. And thank you again for your time today and your important research. Before we go, I'd like to thank the audience for joining us and for their interesting questions. I'd also like to thank our sponsor, Luminex, for sponsoring today's webinar. Questions we did not have time for today and those submitted during the on-demand period will be addressed by the speaker via the contact information you provided at the time of registration. This webcast can be viewed on demand for 2 years until September 9th of 2023, and LabRoots will alert you via email when it is available for replay. We encourage you to email that with your colleagues who may have missed today's live event. Ron, again, thank you so much, and until next time, goodbye.